that will swing back around at the end as a reminder. But before we get started, I just want to say thank you for being here, and I will turn it over to Commissioner Ojiro.
Good evening, everyone. I'm Zana Ojiro. Can I have slide 4, please? I have been involved with the criminal justice systems assessment and the justice system improvement program since I was elected as a commissioner. I'm in my 6th year now. When I first knocked on doors and canvassed to run for office, mental health was one of the top issues that anyone was concerned about at the time. Right now, if I were to knock again, I'm sure I would hear about a few other issues as well, including housing, homelessness, and community safety. The vision that we have for the justice system, thank you, is to provide residents of Benton County with an efficient, effective, equitable system that promotes community safety while at the same time providing treatment options that address underlying causes of criminal behavior. This is a vision that we put together during the process of the justice systems assessment based on a series of different community engagements, both in large settings like this one, and in small groups as we met with people throughout the Corvallis community and all around the county. We really do want to build an equitable, effective, and safe system that meets the needs of all county residents. We're committed to strengthening programs and filling systems gaps in both our programs and facilities. When it comes to milestones, I'm going to start back in 2018. That's when we launched the Justice Systems Assessment along with a group of stakeholders that were both internal and external to the process. The assessment was guided by what's called the system of intercepts, or we wanted to look at what the perspective was from someone that was involved with the justice system, from first encounter with a police officer all the way through to the jail courts, working with defense and prosecution, and back to release into the community. And it was at that time that I became aware of just how intermeshed our behavioral health system has become with our criminal legal system. The assessment report laid the groundwork for our pre-design activities with DLR Group. Those began in 2019, but in earnest picked up speed in 2020, just as COVID hit. We formed a technical advisory committee and a community advisory committee and started to talk to all of these folks about what was important to us in terms of the overall program. What facilities? Did we want to have a campus style approach or separate facilities? What kind of location mattered most? What were the criteria that we should use to evaluate sites? Getting a little feedback. That process then led to the work that we did in 2021 with a lot of community engagement, specifically focused on the idea of the bond measure and the justice system facilities improvement along with programs, but ended up focusing primarily on site selection. We ended up as a board of commissioners landing on choosing what we were referring to initially as the North Site. We now refer to as the Community Safety and Justice Campus, which is just north of downtown Corvallis by about a mile. We were also successful in that time period in obtaining a state matching grant for the courthouse facilities. It doesn't provide any funds for the district attorney's office piece, but we are going to make that investment on our own so that we have a full-fledged courthouse moving forward. Those funds will come available sooner than the bond funds, so we have made decisions to move forward with that courthouse and district attorney's office borrowing on the open market rather than making it contingent upon a bond measure. This year, the board finalized that site selection. And right now what we're doing is, in addition to community engagement, we're focused on design of the crisis center, which will be situated downtown. And we will be working on design for the courthouse and district attorney's office by the end of the year. Lastly, I want to mention that right now we're focused on getting the word out more broadly in the community. I'm really grateful to all of you for showing up tonight and for those of you attending online. But we'd like to invite you to send us your suggestions about your service club, your neighborhood organization, your church group, any other group that we might speak to answer questions about the proposed bond measure before it comes to you and you have to make a last-minute decision. So, critical mental health needs. I think almost everyone has a story about a family member, a relative, a friend, someone's child who has been in dire straits, has needed crisis help for either a substance use disorder or just a mental health crisis, and has not been able to find help, or they've found help, but they've gotten bounced from one place to the other, or their insurance won't cover the help that their loved one needs, or they have been referred to service, but there's no service provider that has any time on their schedule for another 4 months, 6 months, or longer. So we know we have a lot of trouble in that department. We also know that people with intellectual and developmental disabilities often have a hard time and are overlooked in the justice system. Consider the person with autism, for instance, who may not be able to respond in the moment to a question from a law enforcement officer. And often our first impulse is when someone doesn't understand us is to speak louder and faster. And that is exactly the wrong thing to do if you're trying to help someone who has that kind of a neurocognitive disorder. So we are working with ARC of Benton County, thanks to Dr. Gottschall and Diane Scottolini, and we're working to help train law enforcement and others involved in the justice system about how better to work with folks that have developmental disabilities or intellectual challenges. And lastly, our jail is inadequate. It was built as a temporary structure. It doesn't have any space for any kind of therapeutic treatment or any kind of educational programs, let alone outdoor exercise and just the ability to breathe fresh air. So moving on, we know from the literature that experiencing poor mental health does not lead to criminal activity. However, we also know that a high proportion of folks that are ensnared in the justice system here in Benton County, just as in everywhere else, suffer from both poor mental health and substance use disorders, and they may be homeless. This is particularly true of the cadre of repeat offenders for whom our current system continues to fail. We need to address these issues upstream wherever possible to prevent chronic substance use and the need for mental health care. So we are working to enhance those programs. And we haven't been just standing still since the justice system assessment was completed in 2019. We have a pilot program called CORE for Community Outreach, Response, and Engage. It's a partnership with the Corvallis Police Department and Benton County Behavioral Health. It pairs a law enforcement officer with a qualified mental health professional that go out and respond to mental health crises. In addition, that team is providing training, the crisis response intervention training to all the law enforcement folks here in the area. All of our local agencies have a target of 100% officer trained in critical response intervention. And we're getting there, putting on a couple trainings a year. The other thing that we're working on, of course, is what I mentioned before with the ARC, working on better response to individuals with intellectual and developmental disabilities. The Crisis Center is going to be an instrumental resource to support all of these new programs. When the CORE team goes out and responds to a call, they need to have someplace that they can refer people to go in when they're in crisis so that they can stabilize or just be assessed. And that center will be able to house someone up to 30 days in order to actually stabilize and put together a path forward. We also very badly need a new correctional facility that will be located on the Community Safety and Justice campus, which provides housing for adults in custody that actually is meets the needs better for folks that are in mental health crisis or in the depths of substance use disorder. Right now, the jail's small, loud, chaotic, It's exactly the wrong place for anyone that's having those challenges, and it makes it really difficult for everyone, staff, adults in custody alike. Our vision is that we will have a continuum of services that address individuals' mental health crisis long before they become justice involved, with support from our county crisis team and the 988 crisis line, which was enrolled just this last couple of months. So that will be supported by the crisis center, and people will be able to self-refer to that crisis center, be referred by the core team, or have a family member take them there, be directed there by an operator from 988. Then the crisis team itself, the core team, the co-response, hopefully will expand. Right now, it's just a 40-hour per week program. We have plans, which Suzanne will tell you more about, I'm sure. Then lastly, we need that therapeutic element in our correctional facility so that we don't have people come into the correctional facility and just spiral downhill and get to the point where they can't aid in their own defense, where they then have to be sent to the state hospital for that treatment, just to get them to the point where they can help in their own self-defense, not to make them better, and which is a whole nother rat's nest of its own. Our goal is to keep people out of the state hospital, if at all possible, treat people in the community where they have local supports. With that, my part of the program is over for now, and I would like to move it on to our short video and then to Sheriff Van Arsdale.
The Benton County Justice System Improvement Program is a multi-year project that began in 2018 with a comprehensive review of the justice system. With the assessment and recommendations of the foundation, the county's vision is to provide residents with a correctional facility that supports an effective, efficient, and equitable justice system. A justice system that promotes community safety and accountability while providing treatment opportunities that address underlying causes of criminal behavior. The current Benton County Jail was built in 1976 and was built as a temporary facility. So it doesn't have a lot of the updated amenities that you'll see in the current facility. Once you come in there being mental health, maybe you're high, maybe you're intoxicated or impaired, you can't go behind the gate until you mental health get back to a normal baseline with levels of intoxication. So you go to hold it later. We only have 4. And as you can imagine, a community with 100,000 people, once you get those 4 people brought in, the facility shuts down. There's lack of space for us to be there, and so we need somebody in a quiet, private environment. There's lack of space for us to be able to do anything that is truly therapeutic. We do adaptation so that we can, and the staff over there are very good at that. We take very important steps to do this so we can in the current environment.
Hello, I'm talking about today. I probably co-occurring issues or disorders. A lot of things go hand in hand. They can have multiple medical conditions, multiple mental health issues, both simultaneously. And it's tricky to treat all of that.
We work really hard with the sheriff's office staff to do both ways, keep people safe and healthy while they're in custody, and keep people safe and healthy as they're being released from custody. Unfortunately, people commit crime, and there is that accountability piece, which that consequence piece, and we can't house them. And so we been posted north for folks who do the time. So we need from our facility to a facility where they can go up to a year's time without having to go for sending somebody where those support systems are not. You just exacerbated or made worse anything else that they've already learned by taking them away from their systems of care. Maui has studies that say up to 2/3 of adults in custody have co-occurring or mental disorders, mental health disorders. And so us, when I say that's really we are all being able to treat them in their community, and also an environment that's conducive to treatment, which will help them grow and to recover and and can become healthy.
And then once they're released, upon good care of making sure that they have contact when they get out to follow up with a provider and get their prescriptions continued so that they hopefully stay on those medications. And if it's a medication for mental illness, especially, it may reduce the recidivism of them coming up to.
The jails are one of the lessons that kind of my opinion, because they're generally pretty raw. And so there's folks that want to see the treatment. And there's folks that want to see the accountability. And there's folks that don't want to be the victims of crime. And they want to know that there's going to be some consequences of folks who commit a crime.
Having a new facility and being able to take in everybody who should be brought in and have them stay and serve their entire sentence and better themselves while they're here and then be released in a better place than they were when they came in. It's beneficial for everyone in the community.
For folks in the realm of us, the home that they're willing to be. And then I think it's quick conscious telling what are the next job that we do to come up with more programs and more creative ways and to offer rehabilitation groups and to offer, skills training and to offer life skills training, just to be able to offer those things which we can't now. So individuals would improve their lives. And I think it's about the outcome. And they want to be the best possible outcome so they don't reoffend and they can go back and be a productive member of our community.
Can everybody hear me all right? Right on. Pretty powerful video. I really liked it. It says a lot and it speaks to the system. I recently hit a Hallmark birthday, and so I have to wear glasses now to read stuff. So bear with me. Jamie Glass is my office's crime analyst and PIO, and she put a list of things together for me. And I just want to say thank you to her. At the top of the list, it says, don't use acronyms. So if I use acronyms, I apologize. I will try to come back around and clarify what I'm talking about. Police Information Officer. See how that worked? Well done. Thank you. I am Jeff Van Arsdal. I am your Benton County Sheriff. I won't be as articulate or elegant as Commissioner Ogerow, but I'll do my best. As you saw, we need a modern correctional facility where people can be held accountable for crimes committed in our community and where our adults in custody, or an AIC, can get treatment for underlying issues of addiction or mental health. With just 40 beds, our jail is too small to lodge the majority of individuals arrested in our community, let alone provide the appropriate treatment for the AICs. According to the county's 2019 assessment, we need more beds, and compared to our neighboring counties' jails, including Lincoln, Lynn, Polk, and Lane. And I would add Norcor, because I do rent beds up in the Dalles as well. The assessment also indicates a significant need for mental health services in the populations of adults in Benton County in custody. For example, in 2021, out of 782 total bookings in the year, 127 adults in custody visited a psychiatrist, and 127 other AICs visited Benton County Behavioral Health, which left about 31% of the AICs needing treatment. Additionally, about 1/3 of the spending in the jail is on pharmaceuticals for psychotropic medications, which are drugs used to help treat mental health illness, including addiction. Private spaces for jail staff and adults in custody alike are a major necessity. Medical staff to meet with the AICs, a deputy break room, a private restroom, the AIC space for resources. As you saw in the video, the jail is incredibly outdated. This was a temporary facility in 1976. If my staff wants to use the restroom, they have to go out into the waiting room. They don't have their own private space just to have a moment of peace and quiet themselves. Rather than sending our AICs or adults in custody to another jail outside the area, we need a therapeutic, trauma-informed facility. And to be most effective, we need to keep our adults in this community where they have access to their supports, their family, to treatment, whatever it is that's going to help them better themselves and be a better member of our community. These are our community members. We have to take care of them. As you saw in the video, our current jail capacity is small with only 2 holding cells, and then I have 2 waiting cells. What this means in our criminal justice system and our community is once we have 4 folks that come in that are drug affected or are exhibiting signs of mental health, so they need to meet with behavioral health professionals. We can't, with a good conscience, put them behind the gate. So effectively, the jail is shut down after 4 people. In a community of 100,000 folks, that's just doesn't make me feel good. What we learned is nationally, 64% of all people in local jails have mental health issues. This includes mental health issues such as anxiety, depression, bipolar, schizophrenia, addiction, or other illnesses. The job responsibility and duties for a Benton County jail deputy has also continued to evolve in the past 40 years, essentially rendering our current facility too small, incredibly outdated, and insufficient to provide adequate treatment or consistent and robust services to the population we serve. As the commissioner so eloquently put it, loud, small, and chaotic. Well done. We also convene a group involving personnel from the jail, Benton County Behavioral Health, the courts, the district attorney's office, Great Oregon Behavioral Health, the Board of Commissioners, and representatives from the ARC of Benton County to better address the needs of our AICs living with intellectual and developmental disabilities and mental health illness while in custody. Additionally, we need some therapeutic spaces for all the AICs housed in the facility, enabling staff to provide needed services with best practices in mind while working in a much more efficient and functional environment. Like I said in the video, in the end, the outcome is what matters to everybody involved in this process. We want to provide opportunities for anyone who enters the facility to voluntarily participate in programs that will better prepare them to rejoin the community upon their release with the best possible chance and a better outcome. And when we walked in here into this amazing school, there's a quote out here from Linus Pauling. And that quote is, "The best way to have a good idea is to have lots of ideas." And that's the impetus behind the JSIP right here. That's why we're all here tonight. The more we talk about it and the more we discuss things, the better we'll do in the end. So with that, I'm going to pass it off to Suzanne.
Thank you, Sheriff. So my name is Suzanne Hoffman, and I'm the Benton County Health Department Director. My closest connection to the Justice System Improvement Program is the new crisis center that we're planning and in the services that our crisis team already provides in our community, including in the current jail setting. So NAMI, the National Alliance on Mental Illness, tells us that 1 in nearly 5 adults will experience mental health condition in their lifetime. It's easy to think of adults in custody as the other, but a mental health crisis or the effects of addiction can happen to anyone. And our behavioral health staff are committed to supporting the continuum of care for all. When adults in custody struggle with mental health issues and or substance use disorders, they deserve appropriate treatment like anybody else and in an appropriate setting. Our staff work closely with the Benton County Sheriff's Office to provide adults in custody the best possible chance of stabilization and pathways to better health outcomes. As we saw in the video, the current jail facility has severe limitations and is not a space conducive to treatment and stabilization. No one would want their loved one to be in the current jail facility. When adults in custody remain in their community, we'll be able to serve them more appropriately while keeping them closer to their families and support systems. And a larger facility would have adequate space for private therapeutic support and for all kinds of programs that are designed to rehabilitate and reduce the chance of committing another crime and returning to jail. As you heard in the video from our crisis program manager, Eric Bowling, a different facility would open up a whole range of treatment options. And as much as watching that video made me a supporter of a new correctional facility, talking with our crisis team manager and just simply posing the question, Eric, how much difference would it make? I know that you and the team try to provide the best service you possibly can right now in the current jail. If we had a larger space that was more therapeutic and conducive to stabilization, what kind of difference would it make for the quality and the volume of services that the team could provide? And without hesitation, he said, significant. It would make a significant positive difference. And from that moment forward, I was sold. The other major component that I'm excited to talk with you about this evening is the crisis center that will be located downtown. This can serve as a treatment-centered alternative to incarceration or to the emergency room that provides stabilization for individuals experiencing mental health crisis. And when I say an alternative to incarceration, I mean that having this service available may reduce law enforcement interactions with certain individuals, or at least reduce the time that law enforcement officers spend interacting with those individuals. And it can really reduce the judicial entanglements of some people who are experiencing mental health crisis by having that intervention step and service available in our community. But it also is available to many, many more people in our community who have no connection to the justice system and perhaps no connections or interactions with law enforcement. So it's in the downtown, going to be in the downtown area and be very available to our service providers that we work closely with, families. Anyone of any age can walk in at any time to the new crisis center and be assessed for an appropriate level of service. The services will be voluntary, and they include short-term stabilization and referrals and supports for ongoing services. Currently in Benton County, we have just one psychiatric crisis respite bed. We have the Good Samaritan Regional Medical Center inpatient care, or the emergency department as stabilization locations for mental health crisis. Higher levels of care than may be needed, like the emergency department, may not be the best care for an individual, and of course will carry a higher cost. An emergency department and hospital level care really needs to be reserved for those who truly need it. So as I said, the new crisis center will be located in downtown Corvallis, a walk-in facility to anyone experiencing a mental health crisis. The crisis services begin with a risk assessment, and individuals are connected with community resources. And while planning is still in the early design phase, we hope to have 5 to 7 stabilization chairs, which are more like recliners. So imagine something very comforting. And this means that in a chair, a person can stay less than 24 hours, so short-term stabilization. We also hope to have 5 to 7 stabilization beds, which means a stay of up to 29 days. And in-person crisis support 24 hours a day, 7 days a week in the community. So in closing, I would just say we want to support a better outcome for our community by providing spaces for individuals to receive the therapeutic support they need. Thank you, and I'll hand it back to Commissioner Ogerow.
I hope that you will all join us in supporting our vision to have an efficient, effective, and equitable justice system offering a balance of treatment and accountability. We really want to improve, as the sheriff said, outcomes, both for individuals and for community safety. And to achieve this vision, we need the new facilities to support the services that and our treatment objectives to ensure community safety and individual well-being. We'll be putting a bond measure on the ballot in May of 2023. We haven't determined exactly what that will look like. That's a decision that will be made by the Board of Commissioners, likely late November or December of this year. But we look forward to your support. We welcome your questions tonight, and ask the hard ones. We want to know what you're thinking now. We want to be able to have the community discussion to be able to put the right measure on the ballot so that we can successfully invest in these new facilities for the long-term future. Thank you.
How's that? Great. As Commissioner Ogerow said, tonight is a really great opportunity to ask hard questions. This is an opportunity for folks who have joined us online and here in the room to tell those who are listening at the county what resonates with you about what you're hearing and seeing in tonight's presentation. What do you need to know in addition to this? And I think we'd really just like to gain a sense of what level of support you have for what you've heard so far. So to that point, we're going to ask folks to take 10 minutes and wander the room. We have a couple on each side of the room. There's the same question, so just one side of the room. We'll ask folks to take a look at those questions. There'll be a couple stickers for you to sort of to note kind of where your priorities are, where your level of interest is, and then to share some ideas about what additional information would be useful to you to learn. If you're attending online, that option will come as a survey to you. At the end of the 10 minutes, we'll come back and then we'll spend the remainder of the evening answering the questions that you have and attempting to cover the things that are on your mind. So with that, I invite you to stretch your legs a little bit. I want to mention that we have Commissioners Malone and Ogerow and Wise in the room tonight, as well as a number of other staff. And so please ask questions and engage with each other. This is a great opportunity to see folks face to face and in person. And so make sure to say hello to some folks as you do this. So we'll be back here in just 10 minutes. Thank you. Can I get folks' attention just quickly? It sounds like there might be a little bit of confusion around the activity. Excuse me, can I get folks' attention? It sounds like there might be a little bit of confusion around the activity. So if I could, I'm just going to read the questions and then give a little bit more clear directions. There are folks floating around the room on each side. The questions on each side are the same, and there are stickers. And so we're asking folks to go over to one side of the room and answer the questions, which are, what else would you need to know in order to support a proposed bond measure? What is the most important issue addressed by a proposed bond measure? And then lastly, what additional things would you need to? How important is it, do you think, the proposed new correctional facility and expanded crisis center are for county residents? So again, here, just trying to get a sense of where you're landing with regard to the proposed measure. Also, we are collecting these question cards. And so as you came in, you received the question card. Anything you have on your mind that you'd like to share, questions you'd like to pose to the panel, please go ahead and deliver those to myself or Brenda, and we'll make sure to ask them. Great, thank you. We're going to take just 5 more minutes. Again, I want to ask folks, if you haven't already, please make your way to one side of the room. Lindsay and Zan, Commissioner Ojiro have stickers, and we're asking you just to make sure to let us know kind of where you land on each of the questions here. Hey, if folks could start to bring their, if you have questions and want to bring them up here to the front, or Brenda in the black dress over here can also take them. We're going to go ahead and start to reconvene. Okay. All right, if folks could find their way back to their seats, we're going to go ahead and get started with the last part of our agenda tonight, which is a panel discussion. All right, so on the panel tonight, you will recognize our presenters from earlier. Commissioner Ojero, Jeff Van Arsdell, Sheriff Jeff Van Arsdell, Suzanne Hoffman, and then there's a few new faces that I'd like to introduce you to. Nick Kurth is our Justice System Improvement Program Manager. Thank you, Nick, for being here. Andrea Myrie is the Executive Director of Corvallis Housing First. For those of you who don't know Andrea, she's been with the organization for the past 5 years, helping to develop supportive housing and case management services focused on housing for people who've experienced homelessness. And she's also helped to start the Sort Street outreach team in Corvallis. She's a member of HOPE and an advisory committee to the city and county on housing and homelessness services. And then next to Andrea is Laura Hannum. Laura is the CEO of Good Samaritan Regional Medical Center here in Corvallis. I had a pleasure of meeting with her earlier. She comes to us from Vegas.
Yes.
And she's joining us to help to talk about how Good Samaritan is associated with the mental health services in our community, in addition to its role as a level 2 trauma center, regional cancer center, regional heart center, and teaching hospital. They also operate an inpatient mental health unit, an outpatient mental health services, and partial hospitalization program for patients throughout Benton, Lincoln, and Lynn counties. So welcome to all of you to the panel. I also just am remiss if I don't say that we want to thank DA Haroldson and the County Administrator Joe Kirby for being here tonight as well. So a full house of folks who are genuinely interested in hearing the conversation and what's on all of your minds. So with that, I will start posing questions if you're ready. All right. Okay. So these are crisis center related questions. How open-minded or restrictive will the mental health facilities be regarding therapies for addiction and psychosis that are prevalent and poorly understood?
So I'm going to reserve a right to phone a friend because we have some of our behavioral health experts who joined us this evening in order to be able to respond to some of these questions. So could you repeat that one? And then I would ask for some assistance from our team. I'll be happy to repeat it if need be so others can hear.
The question is, how open-minded or restrictive will mental health facilities be regarding therapies for addiction and psychosis that are prevalent yet poorly understood? I'll read how open-minded or restrictive will the mental health facilities be regarding therapies for addiction and psychosis that are prevalent and poorly understood? Oh.
Would you like me to answer that?
Mhm.
Yeah. And I'm hard of hearing, so I need to read this question. Just give me 1 second. At this point in time, we have independent clinicians that follow the best practices that are put forth from most of the empirical evidence, and anecdotally, they've been not anecdotally, and they have been studied for quite a number of years. So we're going to follow best practice procedures and move on from there.
So I think there's a couple of questions in there as well embedded. So I just want to speak a little bit to the psychosis piece. So what we do know about psychosis and it in terms of emitting within our community, we recognize that that shows up at a young age. So the idea is that we also want to get upstream as well. So we take a full continuum of care, of which the crisis center will be one of those components of that full continuum. We have a wonderful program locally called ESA, the Early Assessment Support Alliance. It looks to intervene in the first break in psychosis and helps divert people away from hospitalization. It's a wonderful, innovative model. So we see this continuum as being a part of that process, and the crisis center being an essential component to help establish stability in the community and for have that person remain in the community versus going to high levels of care.
Issues go after 30 days at the crisis center?
So I have a mic. So the length of stay at any particular facility is governed by various regulatory realities. If you stay someplace beyond a certain time, it's in a whole different regulatory framework that requires potentially different workforce, different expertise, different medical professionals, and different licensing and so forth. And that's what those timeframes refer to for a crisis center. So ideally, when someone is within the crisis center and having that opportunity to stabilize, they're also going to be connected with a range of services. And many may leave the crisis center and return to their homes. Some may need a higher level of care and may be referred to a higher level of care, such as a residential treatment facility. And I would welcome the team to chime in with any other options.
Right.
Where staff would
So let me repeat that question for others who may not have heard it, and then we'll return to the questions that we have from other folks as well. The question is, where would staff come, staff resources?
Great, thank you for that question. As you were hearing from our team, we have a range of behavioral health services that are provided by Benton County Behavioral Health that really range the lifespan from kids to adults, to older adults, to outpatient, to crisis services, to a jail and forensic team, and a staff that works directly with the Benton County Circuit Court's Drug Treatment Court program. So that range of services, in addition to, as you probably know, many of our partner nonprofit providers and other private providers throughout the area that make up the behavioral health workforce that our community and that most communities have available. And as you well know, there's a challenge in filling positions all across the healthcare workforce, and particularly the behavioral health workforce. And there are sometimes waits, whether you are someone looking for an appointment into just a basic adult outpatient program at the county level, or whether you happen to have access to a range of other private providers throughout the community. When you call, you may be waiting quite a bit for that appointment. That is an unfortunate state of our behavioral health system all across not only our community, but many. And in some of our programs that we administer, there are wait times, certainly, and we continue to try to work on those in a variety of ways. With our crisis services, there is little to no wait, even currently. We do have some of the same challenges recruiting qualified mental health professionals and other staff as many other communities have. But we also, more often than not, have good retention rates for our workforce, as well as good applicant pools and quality mental health professionals applying for our jobs. So although we certainly have some of those recruitment challenges, not as much as some other communities are experiencing. So we're fortunate in that respect, and I hope that trend continues. And then in terms of the services to be provided, you've probably heard that our state legislature over the last few sessions has really been increasing investment in behavioral health, and most recently with a focus on crisis level services. We hope that that trend continues and that helps us to increase our crisis staffing. That's what we project and what we remain hopeful about. And then, of course, we work closely with our coordinated care organization that is really the Oregon Health Plan administrator for our community, which is IHN, Coordinated Care Organization through Samaritan. And we have funding arrangements and contracts with them, as well as other health plans to cover the cost of those services. So in many cases, the services we provide generate the revenue to help pay for the staff.
Great. Switching gears a little bit, Sheriff, how can we create a new jail that doesn't exacerbate mental health problems and instead promotes well-being?
It's a great question. Currently, we work closely with Benton County Behavioral Health. And so in a new facility where there's a little bit more of a therapeutic environment, private rooms for one-on-one sessions, just places where folks would be able to go and feel a little more comfortable. And I'm not, I mean, a jail's a jail, right? I mean, you can't do much with the jail, but you can certainly make improvements to what we have now so that it is easier for Eric and his staff to come into the facility, meet one-on-one, have groups. Right now, if they want to do it, we really don't have the space. We have a rec room / dining hall / meeting room / whatever else we need to do. It's one room. And we used to have a pretty big outdoor area, but as times have changed, that outdoor area has now shrunk down and it's pretty small as well. So if I'm in the facility and I need some time to breathe, well, you only get so much time and there's only so much room. And so it's built on 1976 standards and it needs to be built on 2022 standards. And so that would be my answer.
Thank you. The next question is, we've heard numbers throughout the presentation and would like them all in one place. What is the current and proposed capacity of the jail, short and long term?
So the current capacity of our jail is 40 beds. And so for a community with 100,000 people, our capacity is 40 beds. And in comparison, Lynn County has a 230 bed facility. Lane County has a 500 plus bed facility. And Polk County has a 195, 96 bed facility. We have 40. And we have a greater population than Lincoln. Lincoln County, I think, is 165 beds. And so when you start looking at the population compared to the beds, it's a pretty big discrepancy. One of the things, if I'm not mistaken, and Commissioner Ojero maybe can correct me on this, but one of the things with the JSIP was our fail to appear rates. And there's just no accountability. So when folks go into custody, they're typically given a citation and recycled right back out because there's nowhere for them to go. And so as a result, we have an incredibly high rate of fail to appear. I have 2 staff members, and that's all they do is manage our pretrial program. And they meet with 500-600 people monthly. They stay on them about court dates, court times, don't miss this, because there's no other way. There's no accountability currently because our facility is small. With Senate Bill 48's passage recently, now we have 3 categories of crimes, and fail to appear is essentially a category 3 crime. And so they need to stay in the facility. But if they stay in the facility for it fail to appear, that means I'm kicking a serious offender out. And so we still have to look at how we're going to do that. We've recently transitioned to the VPRA, which is the Virginia Pretrial Release Inventory, because we needed a validated tool to release folks from our facility. We used a thing for 100 years called the Matrix, and it was developed internally, and we didn't know if it was really the right tool or not. So we partnered with Western Oregon University, the reentry and reentry, and I can't remember the whole, but it's through Western Oregon University, and we had 3 doctors come in, and they examined every single thing we do, and they determined that the VPRA was a more useful and appropriate tool for our community as it related to releasing folks from custody. We just have a really small jail.
Can I tag on to that? We've been talking from the beginning, from the time we did the criminal justice systems assessment, about a 120-bed facility. That may sound humongous relative to a 40-bed jail that we have now. However, in addition to the 40 beds that we have at our jail, which we can't fill all at one time because you have to separate men and women and separate people by the level of crime. You can't mix people that are low-level offenders with felons. So we can only fill the jail to a capacity of maybe 35. And beyond that, we've had COVID, and which means that we've only been able to house maybe 27, 28 people at a time. So we've rented beds in other places, as the sheriff said. We have 10 beds available to us in Polk County. So that puts us at 50. And then we have beds in Norcor and the Dalles, but those are only for people that have been already convicted. And if we count the daily census across all of those facilities, right now we are using far more beds than 40. So we're trying to build a facility that will last us for another, how long has this one been in place? 50 years? That will last us another 50 years, or at least 20. Our planning horizon actually is 20 years. So that's why the consultants that we've worked with, both CGL and DLR companies, have said that 112, 120 beds is about the right number.
Thank you. A question that I'm hoping that Laura and Andrea can weigh in on as well. How will the new Justice and Crisis Center augment or be coordinated with existing and medical crisis services? I'll let anybody who can kick us off.
I am happy to jump in on that one. It would be certainly a relief for us. I think most of us are aware that the emergency room oftentimes is the place of last resort for mental health patients. In 2021, we actually cared for 1,500 mental health patients in our emergency room. And of those 1,500, 200 had to be placed on some sort of hold or in restraints. So it creates an incredible burden, not only for the patient and the patient's loved ones, but for our team. Typically, those are patients who are in crisis. So getting relief, having the level of partnership that we do, we're very proud of our partnership with Benton County Public Health. So being able to partner with Benton County Public Health on another area of expertise for patients in crisis would be an incredible boost for our hospital as well as for our healthcare system. Suzanne mentioned being able to refer for a higher level of care, again, optimizing what Benton County, what our sheriff's office, the county, the city, really being able to optimize across the continuum is critically important. So right now, not only with our inpatient unit, partial hospitalization, for those who may not be familiar, partial hospitalization program, I'm very excited about it because we launched it maybe just about a year and a half ago. What that enables us to do is to provide an intensive outpatient program for mental health patients. They don't have to be admitted to the hospital. They're able to come typically for most of the day to our hospital for intensive therapies, consultation with our providers, and then they're able to go home at night. So again, finding the right place to land a patient after they've been able to be stabilized following a crisis, really what we're talking about just creates those additional places along the continuum, again, optimizing rather than overloading a place. So back to the emergency room, one of the things that we've done over the past year, another development, is we have now placed psychiatric nurses in our emergency room. Their key objective is to build rapport with those mental health patients. But even when you have 2 nurses at a time in our emergency room, 2 psychiatric nurses, I should say, in addition to the ER team, they quickly become overloaded. There are days where we are holding anywhere between 6 and 15 mental health patients in crisis in our emergency room. I was sharing with Suzanne that we're also in this place where there are times where I'll be rounding in the hospital. I'll go to our emergency room and we'll have our entire security department there for one mental health patient. So these are the things that we're looking to balance. And then I'll add one last thing, and then I've talked enough. Back to the staffing question, it's a really key question. Because of Good Sam status as a teaching hospital, in addition to internal medicine, surgical specialties, we also do have medical residencies, programs in adult and child and adolescent psychiatry. So right now, we currently have at this moment, of our 114 residents, 6 of those are psychiatric residents. So we are very committed to doing our part. Doesn't solve it, but doing our part to also generate additional providers, professionals who oftentimes, again, very proud of the fact that since our teaching hospital inception, not just psychiatric, but overall, 155 of those physicians who trained with us remained in Oregon. 53 of them remained in our 3-county area. So the likelihood of those who train in psychiatric medicine, the likelihood is very high, and we want them to remain. So again, them being able to find the right place for them as well as patients to land along that continuum just, again, creates that really synergistic relationship that we're looking for.
So our organization houses people that have experienced, that are experiencing homelessness in our community. We also have case managers that work with clients who are being served in our local shelters. So at the men's shelter, the women's shelter, and in transitional housing at Safe Place, and partnership with Unity Shelter. One of the main challenges that we have is we serve a lot of people that have experienced homelessness, a lot of people that have experienced chronic homelessness. So certainly mental health crisis having a mental health crisis isn't limited just to people that are experiencing homelessness. Indeed, housed people experience mental health crises as well, but it's all that more difficult to try to work with someone when they're facing a mental health crisis or a substance use crisis when they're unhoused, because they may express the desire to us that they want to get help. They want to, they want some stability. But in that time, there's really nowhere for them to go other than for us to call the police, and they end up at the ER. And 9 times out of 10, they end up getting discharged after some short-term stabilization. So the crisis center is really a tool for us to be able to, to be able to have somewhere to bring people that are in crisis, so that we can continue to work with them to try to get them into housing. So we have really good success rates with housing people that have experienced homelessness, that are chronically homeless. Each year we keep an average of about 70 to 80% of the people that we serve in our housing. Those are some pretty good percentages. And I can tell you that out of the people that don't make it in our housing, it's usually due to having a mental health crisis or a substance use disorder crisis, and their behavior gets to the point where it's just not, we just can't keep them in our housing anymore. So if we had somewhere for them to go to stabilize, they could keep their housing, which would be amazing. So we are so excited and supportive of having this resource in our community. It would be a great tool to keep people in housing.
I would just add to that real quickly, in terms of the process for design for the crisis center. We do have a hospital representative on the design committee, as well as a homeless service provider on the committee. So to make sure that both the design of the building as well as the way that the operations flow have community input from people who are most likely to be utilizing the service or assisting others in utilizing the service.
Director Hoffman, on that note, is there a plan to take sensory issues into consideration in the design of the new facility? Sensory issues.
So I'm going to look out at our project manager, Ricky Garcia, who could probably talk a little bit more about that. I saw a thumbs up, so I think the answer is yes, but if you'd like to elaborate on that, Ricky.
But there are people online.
Yeah, I'm Ricky Garcia. I work with the behavioral health program with the county, and I'm the project manager for the crisis center. So this is something that we're taking into consideration. We've worked really well with the other existing programs in the state to find out what works for them and what doesn't work. And this is one of the topics that we definitely discussed. And that is one of the wish list items out in Deschutes, as well as the sensory space. And, with a vast variety of individuals that would utilize crisis services, we need to make sure that we have the facility equipped to deal with any circumstance. So sensory rooms, more space for additional supports, things like that are all things in consideration as we're designing this. To answer the question.
And a very trauma-informed design, obviously. So yes.
The next question, Nick, perhaps you're well suited for this, is the site already established for the crisis center, and where?
I think Ricky could probably answer that question as well. If you don't, do you want me to go ahead and answer, Ricky? Okay, yeah, sure. So a site was selected, I think, back in March, maybe slightly before that. Downtown, you've heard of course. It's actually at the corner of 4th and Van Buren, which is a property that the county already owns. There was a garage there called D&M at one time, formerly Arco Station. That'll be coming down in the next, actually this month probably. And that will be the home and the site of Benton County's Mental Health Crisis Center.
I'm going to ask a follow-up question and stand back here in case the answer resides back here. Could a less expensive option be to remodel county facilities downtown?
So this is actually something that was looked into initially. There was a plan to have the crisis center go where the old BOC building, the Board of Commissioner building is. However, it was actually going to be more expensive to do that. So this was the lower cost option because it was already a county owned space and a smaller facility to demo.
Right. So not only less expensive, but built from the ground up, specifically designed for the population we're going to serve. So kind of a win-win there.
A question for Andrea. What % of the homeless population requires mental health or other health interventions?
So our local statistics suggest anywhere from 40 to 60% of the people that we serve, or people on the street that are in need of some sort of mental health support. There's varying degrees of how much or how intensive. Some people just need a regular check-in like once a week because they suffer from anxiety or depression. Other people have significant persistent mental illness that requires medication and more intensive treatment. So I would say just another reason to have this resource in our community.
Which other communities did you review for ideas, concepts, and program models?
American Crisis Program Manager, Benton County Behavioral Health. We reviewed multiple number of communities and counties. We have visited Deschutes County, we visited Renbend, we visited Bend. We have visited Woodburn. We have visited Gresham, and we have looked at all of the different models that are in place and trying to take the best from all of them and put it into our facility in our community. So in a nutshell, we've looked at this pretty much statewide in different communities and taking it for what it is and taking all of that back to the design committee.
Yeah, I guess the benefit of, I mean, we need this service and site in our community as soon as possible. But if there is any benefit to not going first, is being able to learn from other communities that went before us. And they've been so generous in sharing everything that they learned along the way and the adjustments that they've made. So we're going to be fortunate to benefit from that experience.
Question is, how much will a voted in bond measure cost? Raise our property tax by how much? And can we get state or federal help?
It's a complex question. And as you heard Commissioner Ojero say earlier in the evening, the actual bond amount and components haven't been decided on. However, folks have asked this question previously. And so we did do some analysis relative to a $95 million bond measure. I think for those of you that have been tracking JSIP for the past 2 years, the commissioners early on targeted as a goal to be at or below $100 million for the bond measure. That was based on feedback both from Technical Advisory Committee, Community Advisory Committee, as well as our own internal operational discussions. And we have since also done some surveying, actually just wrapping up our second community survey to help us inform a bond measure amount. But getting back to the specific question on impact on essentially property taxes. So for the average assessed value of a home in Benton County, which is not the market value, the assessed value, it comes in at about $266,000 average assessed value. A $95 million bond would have an impact of about $138 per year. So that's, I think, a good starting point for understanding what the impact would be for an individual. You, of course, would have to look at your own assessed value of your home and do the math. But again, $266,000 assessed value equates to about $138 increase per year, a little over $10 a month. The second part of that question had to do with pursuing other funding sources. And I think probably one of the most rewarding outcomes to date of JSIP is our success in pursuing and securing other state and federal funding sources. So we have a 50% matching grant from the state of Oregon for the courthouse, which equates to about $25 million. We've secured approximately $7.7 million for the crisis center, $1.3 million for the proposed emergency operations center. And we continue to pursue other sources. Hopefully I didn't omit any of our other funding, but we've done quite well on that front and are continuing to invest in looking and pursuing at other resources.
This question is around training and staffing. Only 2 times a year training. How much can we put towards training, opportunity, and monitoring our professionals who are at risk of
My concern is particularly staff burnout and not really a watchdog group. That's kind of a harsh word, I know, but support, not just training, but support for staff and professionals who sometimes work double, triple shifts. Their own mental health is at risk. And burnout can be very dangerous for both staff and their clients. So, I just wonder how much money can go toward not only unaffiliated people who can investigate, watch over, monitor staff so that people aren't investigating their own, and also how to prevent burnout, not just staffing resources, but counselors for counselors, therapists for therapists, so that people can get a break and talk about what they need to so they can go back out and help. That was long. Thank you.
Well, I guess I can begin by just referencing that I think our Benton County Behavioral Health Division leadership team pays very close attention to the overall health of our workforce, going out of their way to ensure that folks have that opportunity for appropriate work-life balance and time away and time for celebration and time for recognition and time for professional development. And then, of course, the county focuses heavily on wellness of its employees, including benefit plans that allow for people to access mental health care. That said, it is challenging because the same behavioral health providers who serve the whole community serve everyone who works in our community too, including behavioral health workers. And so just for your typical outpatient, appointment, it can take some time because of that workforce shortage. And I think that is one of many reasons why our behavioral health managers pay so close attention on site and create opportunities for people to take care of themselves, because knowing that if they are not taking care of themselves, it's going to be very difficult to take care of our clients. Also, I would say that a lot of people in my observation who come to work in this field, yes, burnout is real. And I think especially during the pandemic, there was just a heightened level of exhaustion with people who already have challenging jobs, and then that reality layered on top. On the flip side, though, I would say that people who come to this work love this work. And I would say, probably applies to every program in our behavioral health division in the county. Since we're here to talk about crisis, I would just give a major shout out of recognition to the fact that they not only do amazing work, but it seems that they wouldn't do anything else. They come to it with full passion and intent and dedication. And we try to honor that by keeping them as healthy and appreciated in the workforce as we possibly can.
There is one last, go ahead, Andrea.
I was just going to add to that is that for our staff who are working on the street and people in housing, working with systems that can't serve our folks appropriately. So every time we have to send somebody to the ER, every time we don't have options for people, that is by far the thing that burns our staff out the most. And so adding these resources will make them so much happier in their work. It gives them options for people.
So we are at 7:30, a little bit after. And I want to ask, there's a question here I want to cover. It's an excellent closing question, which is, I can't attend both meetings on this topic. Will there be a video posted? The answer is yes, there will be a video posted online. In addition, we did not get to everyone's questions tonight and apologize for that. And so these questions will be compiled into the questions that appear on the website so that we are able to address those questions and give additional answers and information. So with that, I want to say thank you to our panelists, to our elected officials in the room and our county administrator, and to all of you who've made time tonight, both in person and online, to join for this very important conversation. I encourage you, since it's our first time being in person, to maybe say hi to a stranger on your way out the door, and take advantage of asking questions of those who are in the room before you take off tonight. So thank you very much.